Hello, everyone. My name is Ben, and I'm an associate here at the Brain Injury Advocates of Wyoming. In today's video, we're going to be discussing sleep issues that can occur after someone has suffered a traumatic brain injury. Now, for many of you watching, I'm sure that getting a good night's sleep is probably pretty important to you. However, almost 60% of people with a traumatic brain injury experience long-term difficulties with sleep. Sleep disturbances have been found in people with all severities of brain injuries, from mild to severe. This is because sleep is a very complex process that involves many different areas of the brain, and for this reason, depending on the type of injury and the location of the injury, many different types of sleep problems can occur. Common sleep disorders that might occur after an injury include insomnia, excessive daytime sleepiness or drowsiness, delayed sleep phase syndrome, which causes mixed up sleeping patterns, and narcolepsy, which is essentially falling asleep suddenly and uncontrollably during the daytime. Common sleep syndromes that might occur after an injury include restless leg syndrome, bruxism, in which a person grinds or clenches their teeth, sleep apnea, which is where there is a brief pause in breathing during sleep that results in loud snoring and frequent awakening, and periodic limb movement disorder, as well as sleepwalking. Now, some of you might be wondering, what exactly causes sleep problems? Well, the brain directs you to sleep by putting your body to rest. Injury to the brain can make changes in pathways that affect your sleeping patterns. The brain controls a type of internal clock in our bodies that tells the person when to sleep and when to wake up. There are also chemicals in our bodies that help us sleep, and an injury can change the way these chemicals affect our bodies. If brain mechanisms for starting and stopping sleep are injured, a person may develop a condition called post-traumatic hypersomnia, which may result in sleeping many more hours than usual. The brain also controls the body's breathing while sleeping. After traumatic brain injury, a person may experience apnea of where breathing is paused long enough for blood oxygen levels to drop. Medication taken after a brain injury may also cause sleep problems as well. Prescription drugs for depression and asthma may cause insomnia. Many other stimulant-type medications can cause difficulty sleeping if they are taken close to bedtime. These problems can generally be avoided by changing the time you take your medication. A person should always consult their physician about medication they're taking after they suffer a traumatic brain injury. Other things that may affect sleep after traumatic injury include physical inactivity, pain, depression, use of alcohol, caffeine, and nicotine. There are several things a person can do to help them improve their sleep after an injury. Setting an alarm to wake up at the same time every day, limiting the amount of time you are inactive, exercising, going outdoors, and not taking naps that exceed more than 20 minutes during the daytime are all things that a person can do to help improve their sleeping habits during the day. At nighttime, try to go to bed at the same time each night, follow a bedtime routine, avoid caffeine, nicotine, alcohol, and sugar 5 hours before bed. Avoid eating prior to sleep, but don't go to bed hungry, as this can also affect your sleeping. And keep the bedroom a quiet place free of stress and worries. Avoid watching TV or reading while in bed, and these behaviors will also help improve a person's sleep habits after an injury. A person who suffers a brain injury should always consult their physician if sleep problems persist. Their doctor will be able to help them determine possible causes for their sleep problems, as well as treatment options to help improve their sleep. Treatments may include non-medication options such as relaxation therapy, counseling, and sleep restrictions, as well as medication options such as over-the-counter remedies or prescription remedies that will help you sleep during the night or stay awake during the day. Some natural remedies also exist, such as herbal teas, melatonin, and valerian, which have been shown to be useful for sleep problems. Remember to always consult your physician before taking any prescription or non-prescription medications for sleep problems. Well, this brings us to the end of our video, guys. Hopefully we've been able to give you a little bit of a better understanding about the sleep issues that can occur after a traumatic brain injury. If you like this video, be sure to like the video and subscribe to the channel. That way you stay up to date with all the latest information. As always, thanks so much for watching, guys, and we'll see you in the next one. Have a great day.